my name is Caitlin Davidson, and this is my final video, or my video for the final health assessment. And this is Hunter, that he's going to be my patient today. So I'm going to walk in, I'm going to wash my hands. Hi, my name is Caitlin. I'm going to be your nurse today. Can you tell me your name?
Hunter.
All right, and when's your birthday?
12/5/93.
All right, I'm going to check your wristband. Okay, do you know where we are right now?
Our house.
Yeah, do you know what year it is?
2018.
Yeah, do you know what we're doing right now?
Physical exam.
Yes, so patient is alert and oriented times 3. So I'm going to start your physical exam. I'm going to start with your skin. So I'm going to pinch right here. All right, they're checking for hydration. That the patient has brisk skin turgor. I'm also observing his skin right now. It is normal for ethnicity. There's no jaundice, pallor, or cyanosis. He has no visible lesions, scars, one scar on his shoulder. Nothing open right now. So now I'm going to check for skin warmth. I'm going to go down his arms. All right, and the back. All right, upper extremities are warm and dry. While I'm up here, I'm going to check his radial pulses. Alright, they're equal and strong bilaterally. I would grade them a +2. I'm also going to test grip strength. Please squeeze my fingers. Okay, they're both equal and strong bilaterally. I'd grade them a +5. I'm also going to check his capillary refill. Alright, less than 2 seconds. And less than 2 seconds, so brisk capillary refill. I'm now going to move down to his legs. So I'm going to check. The back. So the lower extremities are warm, dry and warm bilaterally. I'm going to now check for pedal pulses. Alright, both are strong and equal. I would grade them a +2. Alright, can you push against my hands? Okay, pull back towards your nose. Alright, can you lift this leg up? Okay, can you lift this leg up? Alright, I would note that his lower extremity strength is a +5. I'm going to check capillary refill while I'm down here. Alright, less than 2 seconds. In less than 2 seconds, so both capillary refills are brisk on both extremities. Also, while I'm down here, I'm going to check for some edema. He doesn't seem to have any. Push. Alright, no edema noted on either extremity. Now I'm going to listen to his heart sounds, lung sounds, and bowel sounds. I'm going to take a listen to you.
Okay.
Go ahead. Alright, I'm going to listen to your heart sounds first. Alright, aortic. Alright, so aortic, pulmonic, herbs, tricuspid, and mitral. So in all 5 of the heart sound areas, I used both the bell and the diaphragm. I heard an S1 and S2. I didn't hear any additional sounds, any murmurs, gallops, S3 or S4 in either of the sites. I'm now going to check his apical pulse. 66 for an apical pulse. I'm now going to move on to his lung sounds. So do you mind scooting up just a little bit? Right. Breath in and out. And in and out. And in and out. Come on this side this time. If you don't mind showing your back to the camera. Take a deep breath in and out. In and out. In and out. In and out. In, out. All right, his lungs sounded clear in all 5 lobes, both anterior and posterior. There was no adventitious lung sounds, so there were no wheezes, there was no rhonchi. My dog really wants to be in this video. Or rales noted, so clear lung sounds bilaterally. I'm now going to check his vowel sounds. A patient has vowel sounds, normal active vowel sounds in all 4 quadrants. Okay, now I'm going to ask the patient to lay down for me. If you don't mind putting your head right here.
Stay.
Alright, so while I'm down here, I'm going to do an inspection. I'm going to get to the level of the abdomen and the chest. So I'm going to watch him take a few breaths. So over the heart site, there's no heaves or lifts noted. He has symmetrical breath sounds. Symmetrical chest rises and falls. While I'm down here, I'm also going to look at his abdomen. I'm going to see if there's any peristalsis, any abnormal, bowel movement. All right, looks good. I'm also going to do light and deep palpation. So I'm going to start with light. Pain, tenderness. Alright, patient has no pain, tenderness, or guarding. There's also no masses noted. So now I'm going to do deep palpation. Pain, tenderness. Okay, so in deep palpation, there's no tenderness noted, no guarding, no masses, and no organomegaly, so no enlarged organs. All right, I am now going to ask the patient to sit up again. I'm going to come back to the patient's face. I'm going to check your pupils and your mucous membranes. Alright, can you look at my nose? Alright, pupils are round and reactive to light. They're equal. Alright, can you look at this pin? Sorry. They also accommodate, so patient's perla. I'm going to check your mucous membranes. And you say, ah. Alright, mucous membranes are pink and moist. There's no cuts or lesions in there. Tongue looks good as well. And he's smiling for me. He has all his teeth, so that's a good thing. While he's sitting here, I'm going to go ahead and check his blood pressure. So I got 110/74. Do you normally run kind of low?
Yeah.
I do too. Actually, you know what? I'm going to come do it on this side as well. Let me do it. Yep, I got 110/74, so pretty darn close. We'll take it. Alright, we'll put that away. And now for the final part, if you don't mind standing up for me. Can you face this way? Well, actually face this way. Okay, take a big breath in. And out. And in. And out. Okay, turn. In. And out. And in. Okay. Anterior to posterior is less than transverse. His breath in, his chest wall is rising and falling symmetrically. All right. While he's here, I'm going to also check his vertebrae. So I'm going to go down. Do you have any numbness, tingling, sore, tenderness, pain? Okay, so no pain or tenderness noted. Also, as I'm going down, his spine feels pretty straight. I'm going to ask him to lean forward. Okay. Any tenderness when I do it now? Okay, his spine is straight, so there's no scoliosis, lordosis, or kyphosis noted. All right. And that concludes my final head to toe. Thank you so much.